Okay, great. Okay, awesome. So, hello, happy Wednesday, y'all. I hope you are all enjoying this beautiful rainy weather. Um, so we're going to go ahead and jump into the agenda. We just have a couple of announcements. Our epidemiology team is going to give us some updates, and then our friends over at our consumer health and food safety are going to be talking about the neurovirus. And then, of course, we'll leave questions at the end if you for a Q&A. So really quick again, as always, subscribe to the newsletter if you want these updates, in digital form. I'm also going to be talking very briefly about the CHNA or the Community Health Needs Assessment. So just really quick, the Community Health Needs Assessments is the thing that Pima County is currently conducting, which is an assessment that happens every 3 years in collaboration with the health department, nonprofit hospitals, and community-based organizations to hear from community members about what health priorities are impacting them and what we can do to address them collectively. Through primary and secondary data collection, we're able to identify four priority areas, including substance use, mental and behavioral health, access to care, and then social determinants of health. In an effort to gain this large amount of input from Pima County residents, the CHNA includes a survey. The survey is around 20 questions long and takes around 15 minutes to complete and gives Pima County residents a chance for their voice and their opinions about what health outcomes matter to them most be heard. Individuals who complete the survey will be eligible to enter a raffle for a $100 gift card. And this survey can be taken by you or your colleagues at your personal networks. I do want to emphasize this should not be distributed to students, just because we want to make sure. I know that there is a state law that we want to fall into that compliance. So I just want to reiterate, this is only for adults only. So for your colleagues, coworkers, things like that, this should not be shared to students or youth. Um, so with that being said, if you have any questions, Caroline Lewis is the one who can answer that. Her email is right there. And of course, a copy of these slides will be sent to y'all in the newsletter. But if you want to take a second, scan it. We have a Spanish and English version to fill it out. It will be a huge help to not only Pima County, but also to it helps us figure out what we need to focus on as a collective. So with that being said, I'm going to turn it over to our folks over at epidemiology.
Oh, this works better if I can turn on turn on my mic. Hi, everybody. Um, my name is Eliana. I've shared my name before and presented on this call before. And I'm an epidemiologist here at Pima County Health Department, and I'll be one of two epidemiologists sharing updates for this call today. Next slide, please. For our agenda for today, I'll be covering, like I said, as usual, our respiratory update, and then somebody else from our team will come and also share some reminders and facts on measles reporting requirements in Arizona. Next slide, please. For COVID-19, for our yearly report, we're changing our data visualization a little bit. And trying to make it as simple as possible and understandable as well. But for 2024 so far, Pima County has had a decrease of COVID-19 cases as compared to what we've seen in previous years. This is highly affected by the amount of cases we had between 2020 and 2022. However, and thanks to the amount of vaccination and the impact that it's had in our community. You can see those little yellow boxes on the bottom left side of the screen there. That represents the number of cases basically per week. And you can see a slight decrease as compared to the prior week. And then we're seeing that continued trend moving into the next couple of weeks as well. demographics for who continues to be affected by COVID-19 hasn't changed recently, and majority continues to be, or not the majority, but about a third of these cases continue to be individuals age 65 plus. Next slide, please. This one is one you're a little bit more familiar with. Our website and the CDC continue to report on COVID-19 hospital admission levels, and we continue to be on the low metric for this. The recommendations have not changed, and this continues to be available on both the Pima County Health Department website as well as the CDC as usual. Next slide, please. As far as influenza, we are also seeing a decrease in the amount of cases. We're past what we call the peak of influenza season. Usually that is towards the last week of December, first week of January. And you can see on the slide on your screen, and that is what we've seen typically and what has occurred this season so far. While the amount of cases reported has just about doubled, just about doubled, a little bit over doubled what we have seen in years past. This is also affected by the previous years with the COVID-19 pandemic. However, like I was saying, as compared to the prior week and even to the prior month, we are seeing a decrease in influenza activity in Pima County. And most individuals affected, about a third of them, continue to be 19 to 49 years old. We hope to see this continued decrease, but it might plateau for a little bit for the next month or so, as we will continue to be in respiratory season. Next slide, please. As far as RSV, we continue to report on RSV trends on the same cadence as we do for flu. And we have seen a decrease as compared to a couple prior weeks. However, it might plateau even a little bit more than flu usually does. We are also seeing about doubling of what we typically see as far as seasonal numbers for RSV cases. And people most affected continue to be children age 1 to 4, as about a third of what we see as case patients are in that age group. As far as what we might see in the future, we'll see y'all again in the next monthly meeting, but we do expect that trend to continue to go down as it usually does as respiratory season progresses. Next slide, please. Just a few comments on staying healthy. We do appreciate our partnership with the schools, continuing to share important health information with students, families, and staff. Vaccines are safe and effective, and there is vaccines available for COVID-19, RSV, and flu that vary based on applicability on an individual level. Our health department clinics continue to offer a variety of services. And then you guys are more familiar with this one than we are, as you have to issue constant reminders, but continue to share with your school community to have individuals stay home when they're sick. The importance of hand washing often and thoroughly cannot be understating. However, if a kid or a staff member does get sick, there are tests and treatment to be able to help them get better and back to school sooner and faster. And the slides on the right, our communications team does a wonderful job of sharing a lot of this communication and education also on our social media channels. So that's where some of that is coming from. Next slide, please. All right, and I'm going to pass this on to Sophia from our epidemiology team to continue with the measles facts. Thank you.
Oh, Hi, I'm sorry. For some reason, initially my mic was disabled. Hi, everyone. Good afternoon. My name is Sophia, and I'll be presenting information regarding the measles. First of all, I would try to let you guys know and understand the symptoms for measles and how to recognize them. So we're going to be looking for a child with Koplik spots, which is like usually small white spots inside the mouth, and they would have maculopapular rash that starts around the airline and then progress down to the face, to the back, and out to the extremities. Sometimes they will have fever with about 104 degrees Fahrenheit. It also comes with cough, runny nose with red and watery eyes, and coiza and conjunctivitis. Next slide, please. For vaccination, the vaccination requirement for Arizona schools is that they should have proof of MMR. Um, Proof of MMR is required for school entry, but in some cases, for they could be exemptions such as medical reasons, religious belief, or personal belief, which is also subject to Arizona state regulation. It is important for vaccination for community immunity, and the kind of vaccinations we're looking at is typically 2 doses, with the first dose administered within the first 12 to 15 months, and then the second dose is given at 4 to 6 years. Next slide, please. When you're collecting information for a suspected measles case, it is very important for you to, when you find out from the parent, you document the symptoms and make sure you document as many information as you can regarding the symptoms. We got like things like onset date, and you also need to check for the fever, let them describe the rash, where they first started noticing the rash. And then you also check for conjunctivitis, ask if they have cough, runny nose, or if they have the Koplik spots. You also need to verify the vaccination records and check for MMR. And you also need to check with the parent if there is a recent travel history, and you document the dates and where they went to. And then we'll move on to contact exposure, which is who could have been exposed to the measles. And you're gonna detail as much information as regarding the exposures. And for the people in the classroom, we also need to verify the vaccination records for all the contact that was exposed. And also you need to document everywhere the child has been to, so you can properly document the contacts. And you need to notify the healthcare department, the Pima County Health Department, as soon as you find out this information. Next slide, please. In managing the exposure, the steps for classroom assessment, you need to check when the child was last in the classroom space, and you need to document 4 days before the rash started, and then 4 days after the rash started. So you're going to be looking at a period over 9 days, because the day which the rash started is actually day 0. So you have to check 4 days back and 4 days forward. And then you also need to cross-check that with the last time the child was in school, and then anybody that falls within that time range is who you'll be considered a contact. You need to collect all the vaccination record for all the student that was exposed and check to make sure if their MMR was up to date. Then you will check with inform the health department, and with the health department, we're also going to help you with calculating the monitoring symptoms, the exposure period, which is usually 21 days after exposure. And then we will tell you how to properly inform the parent about the exposure and the prevention measures, as well as what other symptoms to watch for. And we also recommend that you clean and disinfect affected areas as much as you can, as soon as after every exposure. Thank you.
Hey, excuse me. Thank you so much. And again, as always, if you have any questions, definitely we can reach out to our EPI team at epi@pima.gov. This is their phone number. And of course, if you have any questions currently, you can definitely put them in the chat for our epi team. So we're going to go ahead and move on. So is Anna on the call?
Yes, Chris, I'm on the call.
Okay, awesome. The floor is yours.
Thank you. All right. So good afternoon, everyone. My name is Anna. I work with the Consumer Health and Food Safety Division. I'm an environmental health specialist too, and a foodborne illness investigator. I'll be talking today about norovirus outbreak detection and management. So today I'll be just discussing a lot about, vomit and diarrhea. So I hope that you guys are not having your lunch right now. So as you know, that norovirus is a highly contagious virus that affects all people of ages. It causes vomiting, diarrhea, and stomach pain. Basically, anyone can get it, and it can spread very quick in a lot of enclosed places like daycare centers, nursing homes, restaurants, schools. People that are infected with the virus can spread billions of particles through their stool and easily affect others. A lot of people know norovirus as the stomach bug or the cruise ship virus. We tend to see an increase of cases and outbreaks from the time frame of November to April. Next slide, please. So some signs to look out for is when a person is infected with a virus, they'll start showing symptoms of vomiting, which is often projectile within between 1 to 2 days. And they may also have diarrhea. Other symptoms may include nausea, headache, fever, chills, and abdominal cramps. And most people recover within 1 or 2 days, and others may take up to like a week or more. Next slide, please. So how usually the virus spreads is you can come to contact with an infected person through, simple as shaking a hand, and then you touch your mouth, or even after carrying someone, changing diapers, and then on some surfaces, it can be contaminated with the virus. And then it can be spread if you don't wash your hands and then you touch your mouth. So some of the quick statistics between 2009 and 2013, per CDC, there was 61% of outbreaks in infected people. So that is a really large percentage. So it's something that we're going to continually see throughout the year. And I'll be talking about some preventive measures that we can implement in places to limit that exposure. Next slide, please. So we do have this outbreak response toolkit that contains a checklist of items that you guys can implement in your schools or whichever place that you work at. So some of the items that are on that checklist includes like a sheet with the track cases. So once you notice, like, for example, if 2 children within the same week are showing, signs of vomiting and diarrhea, you want to report it to the health department so we can assist you and track those cases. So start tracking those by using the log sheet, putting down like the name of the student, the onset of the illness, whether it's vomiting, diarrhea, or any other symptoms, and also the classroom number as well. And once we give you those guidelines, we can provide you some procedures for cleaning up that vomit, diarrhea in the facility. You want to ensure that all staff are trained on proper cleaning procedures. Next slide, please. So some of the control measures would include enforcing hand washing. So I suggest setting breaks just for encouraging, the students to wash their hands, an opportunity for also staff to wash their hands. If any staff or students report to be ill, we recommend that they stay home for at least symptom-free for 48 hours. And then for people that work in the cafeteria or any type of food service for at least 72 hours. We also want to make sure that there is available protective equipment such as gloves, masks, disposable gowns for people that do care for, students that are suspected of having the virus. We want to make sure that we're not passing it on to the staff who do provide care. During the meantime, they're being picked up from like the school, from their parents or relative. We also want to encourage that we notify all visitors, parents of any ongoing outbreaks. We do have norovirus information sheets that we can provide to you. So that way they can be aware on how to protect themselves. I recommend to post precautionary notifications at entrances and exits, just specifically like in classrooms, so that way there's minimal foot traffic from potentially carrying the virus to other classroom areas. We also recommend implementing the control measure of just canceling group activities, sporting events, or social recreational groups until the outbreak is over. This will minimize person-to-person contact and transmission risk as well. Next slide, please. So one of the main important keys in preventing like norovirus is ensuring proper cleaning and disinfecting procedures. So when a student does vomit in an area, you want to make sure that there is ready available cleaning equipment. So you want to make sure that the area is get cleaned first by removing all organic debris with absorbent material. Having materials that can be disposed of right away. We don't recommend reusing mop heads because mop heads contain a lot of fibers, and they can the virus can attach it and can be spread to other surfaces. So if you guys do use a mop head, just make sure that gets tossed and not reused. I want to make sure that after you clean up all the organic matter, that you disinfect the areas using approved agents, and I'll be covering later on my slides what those approved agents are. Additional measures would just be increasing disinfecting of high-touch surfaces. So these are just like doorknobs, faucets, sinks, toilets, light switches, etc. Usually what I recommend is during the downtime that you have. I know it's like some classrooms have like, nap time or recess. I think that would be a good time to disinfect in between. And then you want to ensure also that everyone, including teachers, janitors, are trained on the proper vomit and fecal accident cleanup procedures. Next slide, please. Okay, so as you know, there's a lot of different disinfectants out there. So one way to know if your disinfectant can effectively target the virus, recommend just reading the label on that product. There should be an EPA registration number on there. The label will have a lot of the information on, on what surfaces it should be used on, whether it's like on hard or porous surfaces. And each disinfectant will vary on the contact time. So some will have like a 30-second contact time, meaning that the disinfectant needs to be on the surface wet during that duration to effectively kill the virus. Also, cleaners will only target dirt and debris, and disinfectants will only kill the virus. So what I've seen a lot of places to use is they just use like the basic cleaner, but I tell them that won't really kill the virus. It's only disinfectants. Next slide, please. So on the website, through the EPA, which is the Environmental Protection agency. They provide a list of the registered products that are effective against norovirus. So on the disinfectant label product that you have within your facility, on there, it should be an area where it states the EPA registration number. So all you have to do is kind of take the two sets of number and put it in the search bar on the website. And then it's going to populate the information for that specific or disinfectant that you have on hand. And then it's a really handy tool because it can tell you, you know, if it's something that's ready to use or if it has to be diluted, what it will work on, the type of surface, you know, hard, non-porous. It would also tell you, yes, the contact time is how long it needs to stay wet on the surface. So they will vary. So I recommend looking through your supplies that you have in the schools and just writing down which ones you guys have and kind of looking through this website to see which would be more effective in being used as a disinfectant for cleaning up vomit and diarrhea. Next slide, please. So a couple more things to consider. So if there is a student that does vomit in like the cafeteria or a dining area, consider doing a partial or complete closure until the area gets cleaned. So when someone vomits, those particles can go in all directions and land in other nearby surfaces. So if there's any exposed food or single-use articles, such as like napkins or takeout containers or plastic spoons or forks, I recommend that those be discarded. Additional recommendations, have separate linens from the ones that you guys use for the kitchen and the ones that are used for cleaning up immediate vomit and diarrhea. Just separate so that way it doesn't contaminate the linens and from the kitchen. And if there are any students that are in the nurse's office, for example, and they're waiting to be picked up and it's during lunchtime, I recommend that kitchen staff provide food using disposable containers. That way if they use dishes or utensils, we don't want it being tracked back into the actual kitchen. And if you have any buffet style setups, recommend temporary pausing it until outbreak is over. Buffet style setups have like those serving utensils, so it's going to come in contact with multiple hands. So you want to reduce that and minimize it so that students don't get it from touching it. Or just placing those foods into covered single-use cups. They're just like an easy grab and go. Next slide, please. And then additional control measures, just implement hand washing, after using the restroom, changing diapers, after cleaning up vomit or diarrhea, or if you are assisting someone while they're being waiting to be picked up. If vomit does occur on carpets or furnitures, I recommend to clean it with hot water and detergent and then steam clean for complete inactivation of the virus. We don't recommend dry vacuuming. And then for linens and clothing that have been, soiled with vomit or diarrhea, just make sure to remove carefully to minimize aerosols. What I've seen a lot is staff will just place the clothes and double bag it and provide it to their parents to take home. Next slide, please. And then, as I mentioned, we do have these norovirus information sheet. These can be provided to just generally in the public, parents, staff members. This just informs them of, how they can help in preventing the virus through the community. Next slide, please. And those are just additional sources if you want to look more information on norovirus. And that's it.
Thank you so much, Anna. I really do appreciate it. So with that being said, does anyone have any questions either for on norovirus or with our epidemiology team? And if so, you could place that in the chat. Okay, seeing none. As always, if you want to contact us, oh, we have a question. How can we get copies of the flyers? Anna, did you want to answer that?
Yes, so I can just email them to you. I guess I can provide my contact information here in the chat, or if I can also, I guess, send it to you, Chris.
I mean, if you want, you're more than welcome to provide it in the
Okay.
chat if you like.
Okay.
Are there any other questions? Oh, the next question is, do you have hard copies that they can pick up of the flyer, Anna?
So we don't have a lot of hard copies on hand, but the flyer that we have, it is in a printable version. So it can be emails, and then from there it can be printed out.
Any other questions? Okay, seeing none. If you have any questions, we'll stick around for another 5 minutes, but if not, I'll give you back 27 minutes of your time. Thank you all so much, and I hope you all have a wonderful Wednesday and a great rest of your week. And look out for the next school health update newsletter, which will be sent out on Monday.